known as major depressive disorder with seasonal pattern. It is a type of depression that tends to affect people who live in countries farther from the equator. It is most common during the winter months and tends to resolve in springtime. Other names for major depressive disorder with seasonal pattern include SAD, winter depression, and seasonal depression. According to the American Psychiatric Association (APA), the condition affects about 5% of people in the United States. Symptoms can last for approximately 40% of the year. In this article, we look at how this condition develops, who might be at risk, and the available treatment options. What is SAD? People with SAD, or major depressive disorder with seasonal pattern, experience symptoms of depression with gradually increasing frequency as days start getting shorter. These symptoms slowly improve in early spring as the amount of sunlight increases. The APA suggests that this condition might occur when reduced exposure to sunlight triggers a chemical imbalance in the brain. However, more research is necessary to confirm the cause. Seasonal changes in sunlight affect the circadian rhythms that regulate a person's sense of time. Some people consider this to be their internal biological clock, and disruption to the circadian rhythm can significantly disrupt mood. According to Harvard Medical School, women experience SAD more often than men. SAD also develops in young people more often than in older adults. It is also more common in people who live farther north of the equator, as winter further reduces the hours of daylight in these locations. Less commonly, some people experience SAD during the summer months. Symptoms. The symptoms of SAD are similar to those of depression. The major difference is that symptoms develop as winter approaches and resolve during springtime. Most people's symptoms occur and resolve at the same time every year. Symptoms are usually mild as autumn advances and the hours of daylight start to decline. The severity, characteristics, and patterns of SAD can vary considerably from person to person. The signs and symptoms of SAD tend to include anxious feelings that are out of proportion with their cause or trigger, feelings of guilt and worthlessness, stress and irritability, difficulties in making decisions, reduced concentration, consistent low mood, reduced libido, restless activity, such as pacing, crying, often with no apparent trigger, feelings of fatigue, even after a full night's sleep, sleeping for too long, increased appetite, social withdrawal and a reduced interest in activities that once provided pleasure, difficulty concentrating, overeating and possible weight gain, suicidal ideation. A doctor may not diagnose this condition in people who experience SAD as an effect of seasonally related psychosocial stressors. For instance, people who work seasonally may not have employment during the winter, and they may exhibit some symptoms of depression as a result. Some people experience these symptoms during the summer rather than the winter, with symptoms resolving during the wintertime. However, the most common presentation of SAD occurs during the winter months. Risk factors. Certain factors can affect a person's risk of developing SAD. We discuss these in more detail below. Sex. Women are more likely than men to experience SAD, though this may be due to the higher prevalence of overall depression among women. According to a 2015 overview in the journal Depression Research and Treatment, diagnoses of SAD are 4 times more common in women than men. Geography. The National Institute of Mental Health (NIMH) suggests that living farther from the equator can increase the risk of developing SAD. People who live in places where the days are much shorter in winter are more susceptible. Family history. Having close relatives with a history of other types of depression can increase the likelihood that SAD may develop. Personal history of depression. People with a history of depression or bipolar disorder, as well as those who currently have either of these conditions, are more likely to develop SAD. However, a doctor will only reach a diagnosis of SAD if depression symptoms become more common during a particular season each year. Causes. Experts are still unsure of the exact causes of SAD. However, studies have pointed to the following factors: reduced serotonin production during winter, Serotonin is a neurotransmitter that plays a key role in moderating mood. It binds to a particular protein to travel around the body. Levels of this protein usually drop during the winter months to protect a person against the environmental stress of the season. However, one 2016 longitudinal study in the journal Brain found that people with SAD do not experience a decrease in serotonin transporter levels during winter. The risk is especially high in people who are prone to affective disorders. Disrupted melatonin levels. Melatonin is a hormone that influences sleep patterns and mood. The NIMH maintained that reduced exposure to sunlight during winter's shorter days disrupts the balance of melatonin in the body. Reduced vitamin D production. A 2018 study in rats, the results of which appear in the journal Genes and Nutrition, found links between vitamin D and serotonin that could explain the onset of depression in some people. The body produces vitamin D after exposure to sunlight. Getting less sunlight during the winter months might explain the cycle of depressive symptoms that characterize SAD. Diagnosis. The doctor may ask the following questions to identify whether or not SAD is present. How long has the person been experiencing symptoms? How severe are the symptoms? How do they affect daily activities? Have there been any changes in sleeping or eating patterns? Can a person identify a shift in thoughts and behaviors during different seasons? Can they provide information on any relevant family medical history, such as a close family member with depression, bipolar, or other affective disorders? Because there are several types of depression, it might take some time for a doctor to diagnose SAD accurately. No medical or laboratory test is available for diagnosing this condition. However, the doctor may order some diagnostic tests, including blood tests, to rule out other illnesses or underlying conditions. The APA do not class SAD as a separate disorder in the Diagnostic and Statistical Manual of Mental Disorders, a 5th edition DSM-5. Instead, SAD is a core specifier. A healthcare professional will only diagnose SAD if a person has symptoms of major depressive disorder.